Hello, my name is Allison Cramer and I'm a Research 1 student at Cedar Crest College, and today I'll be asking the question, do simulation labs really make a difference? First, I'm going to start you off with a quick statistic. It has been relayed by the Huffington Post that at this moment in time, the third leading cause of death in the United States is actually medical errors. So this is honestly an astounding statistic that truly needs to be delved into more. The main research problem that we're focusing on is the medication errors. And we're going to use this study to analyze the clinical time used in simulation labs and to see if the effect of simulation on clinical errors differs. Okay, the research question was stated by the authors Sears, Goldsworthy, and Goodman as, does the simulation by second-year BSN students in the medical, surgical, and maternal child placement environments influence the student's ability to safely administer medications? Okay, moving on to the purpose. The purpose of this study was to determine the effectiveness of simulation, to ask if simulation increases the success of nursing students, and to increase the safety and knowledge in medication administration of nursing students. The title of the study was The Relationship Between Simulation in Nursing Education and Medication Safety. This was written by Kimberley Sears, Sandra Goldsworthy, and William M. Goodman. The study design was a randomized clinical trial. This was further defined as FAME, which is our nursing research textbook, as a group of individuals who are further split into an experimental group or a control group. In this situation, the experimental group would be the students receiving the simulation lab before clinical rotation, and the control group would be the students receiving no simulation at all and going straight into the clinical rotation. The list of volunteers was taken from a nursing school in Ontario, Canada, and a random sample was conducted within that volunteer list to come up with each group, the control and the treatment group. And the data was collected using a survey in order to report the medication errors, and this survey was specifically tailored to the study and created by the author Sears. There was no specific framework identified within this research study, and we have two main variables, an independent and a dependent. The independent variable in this study is the simulation time before the clinical rotation, and the dependent variable is the medication errors. Okay, the research sample consisted of 54 students total that comprised 24 students within the treatment group and 30 within the control group. The inclusion criteria was the students particularly in this specific institution in Ontario, Canada, and they must be a second-year BSN student at this time of the study. The exclusion criteria, however, was not specifically stated by Sears and the other authors, but it came to the conclusion that the participants could not be from a different institution, they could not be in any other major besides nursing, and they had to be in the second year at this time. So if they were a nursing student and they were in their first, third, or fourth year, they could not participate. Okay, moving on to the results. The results were analyzed using the survey as previously mentioned and a chi-square method to determine the overall outcome. And the reliability was also examined, and it was found that the treatment was significant with a p-score of less than 0.001. The errors, which the final results revealed, were that the treatment group, the group that had the simulation lab before clinical rotation, only showed 8 errors within the clinical rotation, and the control group, which received no simulation, had a total of 23 errors. So that kind of proves our hypothesis of saying that simulation decreases medication errors in the field. There are a few research limitations to this study. The main is the inability to generalize the data to all nursing students. Because this was a small sample and was only studied in one specific institution, we can't generalize this data to a broad amount of people. Also have to look at the different computer systems used in different hospitals. So the control group and the treatment group actually were at different hospitals, and they had different computer systems to use medication administration for. So it was said that possibly the one computer system may have been more user-friendly than the other one, so that does have to be factored in. And the bias of the clinical preceptors also has to be factored in, because each group had a different clinical preceptor, and each clinical preceptor's hardness in reporting the errors was slightly different. In addition, the demographics, the prior knowledge of medication or any sort of hospital-like work, or the academic standing of the participants was not assessed by the researchers in this study. The implications for nursing is to ultimately decrease the medication errors in nursing students on the floor. And in turn, this should improve patient care. It will lead to less malpractice and increase the health of the patients. And in conclusion, we now understand how simulation actually helps the students in clinical rotation. The hypothesis, as I stated earlier, was proven that simulation decreases the medication errors. And in conclusion, although the hypothesis was proven, more nursing research needs to be done with this study because of the extremely small sample and only one institution used to find the results. Okay, here are my references used, and that concludes my presentation. Thank you.